Hey guys, this is Curtis Alexander. I'm a pharmacist. In today's video, I'll be talking about the side effects that you can see from lisinopril. In case you don't know, lisinopril is a very, very common blood pressure medication, but it does come with a host of potentially severe side effects and then some more common side effects that may not be as severe. So I'm going to go into not only what those are, why they happen, what to look for, and talk about some other things along the way. So hopping right into it, it's important to note that, so when you take lisinopril, it's an ACE inhibitor, angiotensin converting enzyme inhibitor. So it blocks the conversion. Angiotensinogen is secreted from your liver. It goes to angiotensin 1, then to angiotensin 2. Angiotensin 2 has a whole host of effects in your body. One of the biggest ones is it causes vasoconstriction, causes the blood pressure to go up. Lisinopril blocks this step, so AG1 cannot go to AG2, so the end result is you can't have as much vasoconstriction. So I don't want to say it's vasodilation per se, but your blood pressure will go down. But the other important thing is that angiotensin 2 does a bunch of other things in the body, one of which is decreasing, or it causes the metabolism of bradykinin. That's going to be really important for one of the side effects. It goes to your kidneys. It has effects on water retention, all these things. So just so you know that, yes, it can help with blood pressure, but it does have wide-ranging effects downstream. So the biggest, not necessarily the biggest, but the first side effect that I want to talk about is your kidneys. Okay, like I said, angiotensin 2 has effect on the kidneys in a roundabout ways. So there are certain groups of people that we need to be much more careful with if they're taking lisinopril. So first of all, if you have any sort of current kidney issues, you need to be careful. Older age, generally consider that 65 and older. If you're taking any NSAIDs would be ibuprofen, Aleve, those sorts of things. Are you taking any diuretics? You'll want to be careful as well, okay? And the other thing is, if you're getting started on lisinopril, talk to your doctor about starting at a lower dose. Your doctor's probably going to be aware of that, but just in case, the higher that you start your dose out at, the more we see some of these kidney issues. So usually 5 to 10 milligrams a day would be a good starting point. Next, we're going to talk about angioedema. Angioedema is just basically swelling, and it's severe swelling. It tends to occur in the head and neck area. It can also occur in the intestinal area. Okay, and there's certain patients that are at a much higher risk for this. The first one is Black patients, 4 to 5 times higher risk. So it's a huge risk. So that's something to watch out for. Females have a higher risk of that. So do smokers. Again, we're seeing age playing a role in angioedema. So do seasonal allergies. And there's a couple of groups of medications that can increase your risk of seeing angioedema when you're taking lisinopril. There's a class called mTOR inhibitors. You want to watch out for that. Not a common class of medications, but something to keep an eye on. And also neprilysin inhibitors is contraindicated. You cannot take these. So a couple of things, your pharmacy should be checking for these interactions, but sometimes things get missed, so keep an eye out for those. This one is a little more common, but it's also very problematic, which is the cough. And you see it in a lot of the ACE inhibitors, not just lisinopril, but it's kind of a dry, non-productive, annoying sort of cough. Okay, now remember when we talked about what angiotensin 2 did in your body? One of the things is that it broke down bradykinin. Well, when you block A2, you see a decrease in the metabolism of bradykinin. So we see increased bradykinin levels. We don't know this for sure, but it's one of the theories why we think we see an increase in cough with ACE inhibitors. So it's that bradykinin component. Now, there's a couple of populations that we have to be careful with that we tend to see it with more. One of which is females. Obviously, we got a trend here. Females tough time with lisinopril. So that's something. Also, we believe there might be a genetic component. We talked about bradykinin, but there's some people who they have no issues with lisinopril. So is there a genetic component going on with the cough? We think there is, but that's a theory right at this point. As far as if you get the cough, what do? Well, you have to stop taking it. How long will it take for it to go away? Some patients, it can be as little as a week. Some patients, it takes them months before it goes away. So it's not always stop it and it goes away right away. So just keep that in mind, okay? The next thing I want to talk about is increase in potassium levels. Again, because angiotensin II goes to the kidney and these other organs, we can see an increase in potassium. This becomes problematic in our folks who have congestive heart failure. If you're diabetic, something you want to keep an eye out for. Obviously, kidney disease, so these almost kind of tie in together. And drugs, and I won't go into unless there's a lot of them that can increase your potassium levels. So lisinopril is one you want to make sure your pharmacy does a drug interaction check on, okay? Now these two are what I would consider a little more common. Generally not as serious, but one of which is hypotension or decreased blood pressure, low blood pressure. 4 to 10 or 11% of folks will see this. Again, if we start out at a lower dose, I don't see it being a huge issue, but it's something to keep an eye out for. The other thing is dizziness. 4 to 19% of folks are going to see some dizziness. Again, we're talking about water retention. We're talking about all these effects downstream that we're now blocking. So we can get some of these dizziness things, and it may be related to the low blood pressure too. So sometimes these things are tied in together. One of the questions I get, what about alcohol? Can I drink when I'm taking lisinopril? Well, first of all, we have to define, what do you mean by can you drink? If it's a glass of wine at night, and you've always had a glass of wine at night, and you introduce lisinopril, do I think it will be a huge deal? Probably not. If you're having 3-4 drinks a night, it can be, and here's why. Because when you drink alcohol, particularly chronically, and at higher levels, when you drink, we'll see a decrease in the blood pressure in that first 12-hour window, but then we get this rebound increase. So it's very common to see people who drink, and more people who are chronic drinkers at higher levels, they have elevated blood pressure. So on a short-term low level, is alcohol a problem? Obviously you have to talk to your doctor. Generally not a big deal, but if it's more than a drink a night, maybe 2 drinks, yeah, it could become problematic. So let me know in the comments, have you taken lisinopril? Did it help? Did you have side effects from it? If so, what were they? It helps me, it helps the other viewers, and I'm just curious that way. So let me know in the comments. As always, I appreciate it if you subscribe, if you like. Very helpful, and hope this was helpful. So until the next one, thank you.